This is typical case of severe azygous vein stenosis here, just below the arch, and you can see the blood is going through a huge collateral. When we see this collateral in venous pathology, this means there is significant narrowing, because the main vein they can't drain this area, so the blood goes into the collaterals. Again, this is very nice demonstration of association with of the venous malformation with lesions in the spinal cord. This patient has very tight narrowing of the azygous vein, and you see the reflux of the contrast into the spinal cord and down into the left renal vein. And this is the MRI of the dorsal spine for the same patient. You can see the lesions. It's very, very close to the basivertebral vein. Again, outlet obstruction. This is one of the common finding on azygous obstruction at the level of the outlet of the azygous vein. All the contrast is going down to the left renal vein and into the spine. This is during the dilatation, and you can see here the flow after the dilatation. Azygous twisting, also common finding in azygous lesions. Probably the most common finding is azygous twisting, and in most of the cases, very poor result after angioplasty. So in azygous twisting, we have very low threshold for stenting. So this is after several angioplasties, still there is some narrowing here. So, and this is the stent inside. Again, a similar thing, azygous narrowing here, just below the arch, very poor result after simple angioplasty, and reflux into the collaterals. And this is during stent in place deployment, and this is after deployment, there is no more reflux. Multiple azygous stenosis usually respond very well to simple angioplasty. Long stenosis in the upper third of the azygous vein also usually respond very well to simple angioplasty. Tight narrowing in the lower third of the azygous, and most, not all the time, it responds to simple angioplasty. This is a very tight narrowing, and you can see the dilatation just below the narrowing, indicating this is very significant narrowing. And this is during angioplasty, and this is after angioplasty. A similar thing, very tight narrowing here and the collateral formation. This is post-angioplasty. Still there's a reflux down into the left renal vein and into the spinal cord, but it's much better than before. In this case, you have two options, either to stent or wait and see. Again, similar thing, complete azygous occlusion. All the contrast is going down to the left renal vein and upward into the spine. Very good result after simple angioplasty. Sometimes there is variation. You can't find the azygous vein, so you have to look to see other sites for the azygous. Azygous stenosis, in conclusion, respond very well to simple angioplasty, except twisting and extrinsic compression. These are very good indications for stenting, which is found in about 10% of our patients. Just to show you some clinical manifestation of CCSVI in a few of our patients. This patient has almost complete occlusion of the right internal jugular vein, and this is the image taken before the depression procedure. You see the dilated vein on the frontal subcutaneous region. This is another patient. We need to switch the light to see the sign here. Dilated vein in the periorbital region here, or in the frontal region, and this is immediately after the procedure, disappearance of the subcutaneous dilated vein. Another patient, dilated vein in the periorbital region, and this is a few weeks after the procedure. Similar thing, left eye, the subcutaneous vein in the periorbital region, and this is a few weeks after the operation. These are some experience from our patients following liberation procedure. We classify the symptoms into symptoms that respond very shortly after the procedure and the symptoms that do not respond on a short term after the procedure. Symptoms that improve very shortly after the procedure, like coldness in the limbs, urinary symptoms, blurring of vision, the facial color, choking, chronic fatigue, and tinnitus. These symptoms could be directly related to the CCSVI or venous congestion. Some symptoms that improve very slowly following liberation procedure, like speech, balance, and motor dysfunction, like throat. This could be related directly to nerve damage, and we have some symptoms that do not respond at all to CCSVI surgery. These are some clinical correlation with the angiographic findings. A patient with bilateral internal jugular vein stenosis, they usually present with optic neuritis. Patient with bilateral internal jugular vein, unilateral internal jugular vein stenosis, optic neuritis. Bilateral stenosis, they have usually supratentorial lesions on MRI. Patient with severe azygous stenosis or twisting, they usually have very severe disability. And in our experience, what we call the severe three-vein disease is associated with ADAM, and we have one case of ADAM, cerebellar lesions, and brainstem lesions. So in conclusion, CCSVI is a fact. The pattern of CCSVI is correlated with the clinical presentation of the patients. Pattern of CCSVI is predictable of prognosis of multiple sclerosis patients. A treatment of CCSVI relieves some, not all, some MS symptoms. It decreases the further attacks and probably will stop the disease progression. So in conclusion, MS patients usually have MS and they have CCSVI. The MS, which is manifested by nerve damage and lesions in the brain and spinal cord, need to be treated by our colleague, the neurologist. CCSVI is manifested by multiple stenosis and need to be treated by the interventional radiologist or vascular surgeon or cardiologist. So it's time for both to shake hands and to treat the MS patient.